Travel experts warning of severe disruption over the new year. We've just been talking about that. We're going to talk about smoking now, because the Better Health Smoke-Free campaign highlights research that shows the impact adult smokers have on the young people in their lives.
New statistics show that 4.9% of young teenagers whose caregivers smoke also smoke regularly. On the other hand, 1.2% of those whose caregivers do not smoke. Health Minister Maggie Throop said she hoped the research would give parents extra motivation to quit smoking. Well, here to tell us a little bit more about this is clinical psychologist from University College London, Dr Bettina Hohnen. Welcome to our show. Just tell us a little bit more about these statistics, and has the pandemic actually, with respiratory being at the heart of this, impacted people's decisions to stop smoking possibly?
Yes, so there is this significant and growing body of evidence that's showing that children are 4 times more likely to become heavy smokers if they have parents or caregivers who are smokers themselves. We know that the primary motivators for people to want to give up smoking are to do with health, to do with money, but also to do with family. And so this research is really important. It's based on a social learning theory, which is one of the oldest theories in psychology, which says that children learn by observing and by imitating the most relevant models in their lives, and parents are those models. So in all aspects of their lives, parents are socializing children, and smoking is one of those behaviors. It's a learned behavior. Thinking about the pandemic, I think there is some evidence of increase over the pandemic, but I think this research is actually much more important in thinking about the impact that parents have on their children's later behavior.
Bettina, I was going to say, this is really interesting because my dad has smoked all his life, and for a very small period in my early 20s I did smoke, and then I managed to give it up. But I'm interested what the effect you think may be, and maybe your research doesn't cover this, but maybe just off the top of your head, what you think the research would tell us about those who co-parent and where the influence would be on a child that's effectively parented by 2 different families.
Yeah, it's hard to say, to separate out the impact, but we know that there's a kind of dose effect. So the more adults you have in your life who are modeling this behavior increases the chances of you taking up smoking yourself. It's not a direct relationship, that's for sure, but it's 4 times more likely is actually, fairly significant. The other thing is we know that 80% of adult smokers took up smoking themselves before the age of 20. So actually, most people who are smokers now are likely to have started smoking when they are children. And it's a habit. Our brain actually loves habits and behavior. It's a very efficient way for our brain to work. And habits are really hard to break. So if children have started smoking, then and are more likely to go on to become smokers themselves in adulthood, they have this really big mountain to climb to try to give up as an adult, which we know is a really hard thing to do, but really worthwhile.